Hello, I am Yong-Seok Kim from the Department of Surgery at 의정부 St. Mary Hospital of the Catholic University of Korea. This is a short list of what we will cover during this talk. Sonographically, the breast is divided into three layers located between the skin and the pectoralis major muscle. The esophagus is commonly placed to the left side of the trachea. The advantage of this technique is that operators can freely fine-tune the needle path during localization. Naturally, the less important vessel visualized along the localization path, the safer the path will be.